Good day, this is Dr. Joe Ellis. Gum disease is the major cause of tooth loss in the United States. The purpose of this video is to show how gum disease works.
Tooth, or you don't have any periodontal disease. So let's say this is a tooth with enamel, which covers the surface of the tooth, the crown of the tooth. Most of the tooth is made up of dentin, and in the middle of the tooth is the nutritional area called the pulp. There's a thin layer on the roots of the teeth called cement or cementum, which provides for the attachment of the tooth to the bone. Bone surrounds the tooth and is filled with these nutrient canals just like a tooth, but it does not touch the tooth directly. Rather, the tooth is held in the bone by a ligament made of a bunch of fibers that run from the cementum of the tooth to the bone. And you have gum tissue, which is composed of two layers, an outer protective layer and an inner nutritional layer with blood vessels, nerve endings, and lymph supply, just like bone, tooth, heart, lungs, liver, arms, legs, what have you. The same basic pattern throughout the body. And what happens in periodontal disease is that the bacteria, which are normally present in the mouth, crawl down in this crevice between the gum and the tooth. And they only know how to do one thing, which is eat gum tissue, because they get their nutritional supply from the blood serum in this area. So they eat away the outer protective layer of the skin. That creates a little bit of pressure on the bone, and pressure destroys bone. It doesn't make any difference where it is. If you use a pencil a lot, you get a notch right here. If you wear glasses, you get a little notch on your nose. So it destroys bone, whereas tension maintains bone. That's how the orthodontist moves a tooth through bone. Let's say then that the bone is destroyed this far down. You still have the ligament attachment, and the gum tissue may appear to be fairly normal. It may look fine on the outside, but notice the blood vessels and so on are exposed directly into the mouth here. This is why the gums bleed, and this is the only reason that the gums bleed, from infection here in the gum tissue. Now, we've got bacteria which are down in here, happily eating away and surviving on the blood serum. Also, they're free to go into the blood system and distribute themselves throughout your body, which is getting a lot of attention in the medical press these days. So what happens is that this becomes, if you clean the bacteria out from here, this one point, just this point right here, you've already cleaned it up in here. So this becomes the target. This is the only place that matters for cleaning. If you clean this out, then this skin or gum tissue grows right back down to here and heals in 2 to 5 days, provided there are no spirochetes. Now, if you brush the way the teeth grow down from above and up from below like we've always been taught, then that doesn't work. Then you're just doing this, and you're not even getting down into the place that matters, you see. So that's why floss is so important, because floss, which is slipped between the teeth and slided around the tooth to get to this point, can disturb those bacteria.
For more information about how to stop gum disease, see our other videos and visit our website at 4smiling.com. That's the number 4, SMILING.com. This is Dr. Joe Ellis.